Friends, in this video, let us see the Flexor Retinaculum. Okay, Flexor Retinaculum in detail. So, first of all, any retinaculum is nothing but modification of deep fascia. Okay, modification of deep fascia. Any retinaculum. Okay, wa? Whether it may be extensor or maybe a flexor retinaculum. Okay, wa? So, the flexor retinaculum, as the name indicates, it is present as the flex in the present as flexor compartment. Okay, it is present in the flexor compartment. Okay, first of all, let us see its attachment. Okay, first of all, before the attachment, let us see the the location. Okay, the location where it is present. It is present behind the medial malleolus. Okay, behind the medial malleolus, behind and below. Okay, it is present behind and below the medial malleolus. Okay, now the attachment. Okay, the attachments are, let us divide into two parts. One is superior and inferior, or upper and lower. Okay, so now in the upper part, it is attached to the lower or posterior side of medial side. Okay, particularly the medial side of medial malleolus. Okay, medial malleolus. And in the inferior, it is attached to the calcaneal tuberosity. Okay, calcaneal tuberosity. Okay, let us clearly will see in the diagram. Okay, now, and from here, what is the function of this retinaculum? So, function. Okay, the main function is to adhere the vessels and nerves. Okay, adhere the vessels, nerves, and tendons. Okay, okay. From the diagram, let us see here. Okay, this is medial malleolus. Okay, next, this is flexor retinaculum. So it is present medial malleolus behind and below. Okay, and attached to the calcaneal tuberosity of the calcaneum bone. Okay, now it adheres the vessels and tendons. These are the vessels and tendons. Okay, that passes through the flexor retinaculum deeper. Okay, so now next, what are the structures that are passing through flexor retinaculum? As we already seen in the extensor retinaculum, okay, the Himalayas are not dry places as we seen right in the extensor retinaculum. So for here also, there is one small trick to remember. Okay, so for flexor retinaculum, the trick is the doctors are not here. Okay, this is the trick. Okay, the T represents the tibialis posterior. In the extensor retinaculum, we saw it is tibialis anterior. Okay, this is tibialis posterior, and the D represents the flexor digitorum longus tendon. Okay, in there it is extensor. Okay, in the flexor retinaculum, it is flexor. Okay, now the A represents the posterior tibial artery, and the N represents the tibial nerve. Okay, and the H represents the flexor hallucis longus tendon. Okay, now as we seen right, so let us clearly see from this diagram. Okay, so in this diagram, first structure that passes deep to the flexor retinaculum is tibialis posterior. This one. Okay, now, the second one is flexor digitorum longus. This tendon, right? Tendon of flexor digitorum longus and posterior tibial artery. This one is posterior tibial artery and the tibial nerve. The tibial nerve passes here. Okay, and flexor hallucis longus. Okay, this one. Okay, okay. This is the longest tendon. Okay, flexor hallucis longus supplies the great toe. This is great toe. Okay, now one of the applied aspect of the flexor retinaculum is Tarsal tunnel syndrome. Tarsal tunnel syndrome. Okay. The tarsal tunnel syndrome is nothing but, as I already said, right, the tibial nerve present here, right? The tibial nerve which is present, as I already said, the tibial nerve which is present here. Okay, the tibial nerve which is present get or got compressed. Okay, got compressed deep to the flexor retinaculum. Okay, this causes the tarsal tunnel syndrome. So, what are all the clinical correlations present? Okay, what are all the clinical correlations that are present in the tarsal tunnel syndrome? So, first one is, it is burning sensation is present in the sole of the foot and the pain is seen. Okay, and third one is tingling sensation. Okay, tingling sensation is seen in sole of the foot. Okay, this is present in the sole of the foot. Okay, wow. Now, these symptoms, okay, these are all the symptoms. Okay, the symptoms are get relieved or got relieved. Okay, whenever this flexor retinaculum is surgically divided. Okay, surgically divided. Okay, wow. So that's all for the flexor retinaculum. So in this video, we have been clearly seen about the flexor retinaculum in detail. So thank you for watching.